This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And thank you so much for joining us this morning on Columbus Concerns. We, of course, are going to focus on the coronavirus pandemic and some of the developments this week. We're going to start off hearing from the Ohio Adjutant General, Major General Jon Husted. His soldiers from the Ohio National Guard and Reserves have been out helping food banks replenish their stocks of food for the most needy Ohioans, but now they have a new task, and that is helping build hospital capacity. So this week on Columbus Concerns, we're going to start off with Ohio Adjutant General, Major General Jon Husted.
We're dialed in with a laser focus on this build-out to make sure that when we hit the peak of infections here in Ohio for the COVID-19 cases, that we give the frontline warriors, those healthcare providers, the best chance possible to ensure that no patient who needs healthcare goes without the appropriate level of healthcare due to shortage of beds or bed space or equipment. So we're working tirelessly at that. We have two great advantages working in our favor right now. One is the fact that we have a 3 or 4 week look at what we have coming. We know what other states have experienced. We know what other countries have experienced. And we're applying those lessons that we've learned from doing that to make sure that we provide the best care for folks here in Ohio. The second advantage is the fact that Dr. Acton and the governor some time ago strategized this regional approach, so that the major health systems, the hospitals, the nursing homes within regions, all the health providers come together and work together to optimize the resources that they have. What that means is that we know under this structure that the sickest patients have the opportunity to land in a hospital. They're going to be in the acute care facilities, in the rooms that are set up to provide the care for those sickest patients. Other states have not had that advantage. So that's very important, because that means that the facilities that we're looking at building out are going to be for the less sick patients. That means that the requirements are going to be at a lower level so that we can build those facilities out more quickly and provide the support that the healthcare systems need. So what you may see in the communities may not look like you've seen in other states. You may not see trucks full of construction equipment and builders building things, because that's not the approach that most of the regions are taking. Most of the regions are taking the approach that we're going to go into a larger facility and build out that facility for care of those lesser sick patients. So while you won't see guardsmen, Corps of Engineers necessarily building things, what you will see are maybe assembling partitions for those facilities, the transportation of beds. So those are the sorts of things that we're looking at as we talk about building out facilities. And it's important to point out that it's going to be different for every region, because the hospitals in those regions are different, the approaches are different. But again, the strategy is to make sure that the sickest patients land in the most critical care rooms so they get the level of care that they need. And so we are in support of the healthcare system, but it's important to emphasize that this is a consolidated approach. So it involves community leaders, it involves the healthcare providers in those communities, it involves the emergency managers. And when the governor talks about our teams that are on the ground, our teams are there not only to coordinate that effort and to interface with our healthcare systems, but we have other teams of engineers that'll be moving around the community doing the assessments of those facilities. So it's exciting to watch this develop, because the approach is working, and we know that the approach is working. And the key is to make sure that we get the right resources, right surge capacity to the place where it's needed the most at the right time. And again, when I talk about surge capacity, it's not just the facilities. We have lots of folks inside the Department of Health that are working to build staffing capacity, staffing surge capability, so that when those healthcare workers, those frontline healthcare workers run out of capacity out there in the hospitals, we may be able to surge doctors, nurses, and other professionals to help assist with that. Those capabilities are limited, so it's important that we get them, that we prioritize and we get those resources to where they're needed at the right times. And this is all occurring while the Guard's continuing its other missions. The food pantries, we're working in 12 food pantries around the state, and we expect that footprint to grow. The Guard's helping run PPE warehouses for the Department of Health. And of course, our Ohio Military Reserve is running a donation warehouse at our Sullivan Avenue Armory. So we are open for business to take donations of PPE at Sullivan Avenue, and you can find that address online. And before I leave, sir, I'd like to talk about one other topic that I think is important. It's a slightly different topic, but it's equally important, and that's cyber hygiene. Quite frankly, right now, our networks, our computer networks, we know our systems are probably running at a higher capacity than most have run probably ever. More people working from home, more e-commerce being done, more telework by our workforce. And so it's important that we protect the network. So I advise you, use this time wisely at home to protect yourself and your family. Change those passwords. If you're like me, every one of your kids' friends who's ever come through your house with a device has your Wi-Fi password. It's probably a good time to change those passwords on your routers. Now is a good time to make sure that your kids are practicing good cyber hygiene. Take the time to do that. It's cumbersome. Update your antivirus softwares. Every node that we protect helps us protect that network, and protecting that network certainly protects commerce here in Ohio. So thank you for doing that, and thank you for what you've done as Ohioans to help flatten the curve. Every one of your individual efforts contributes to how tough the fight is going to be for those first-line providers, those healthcare workers that are going to be slugging it out during the peak of this surge. Every one of your individual efforts will help determine how tough that fight will be for them. And right now, we're in a great place. And just like our flagship football team, the Buckeyes, we always find a way to win.
Up next on Columbus Concerns, we're going to focus on the backbone of Ohio's economy, which is small business. The Lieutenant Governor, Jon Husted, has been part of that effort to try to help small businesses weather the storm while so many are closed during this coronavirus pandemic. He gave an update on Friday of the very latest when it comes to help available to Ohio's small businesses.
I wanted to talk about a couple of things today. We'll first start with small business. Actually, just a couple hours ago, Columbus Mayor Ginther and Dayton Mayor Whaley and I joined a virtual town hall with small businesses from across Ohio to get their perspective on how things are going for them, what ways we can assist them, some of the struggles and the innovations that they're going through. I was frankly just amazed at the creativeness and the ingenuity of how they've pivoted during this time to try to supply new things that are needed in the economy. Because we were on with Columbus Mayor Andy Ginther, it reminded me of a phone call that I had with the governor 31 days ago today, where he said that he had just gotten off the phone with Mayor Ginther, and they were talking about banning spectators from the Arnold Sports Festival. And I remember at the time how difficult of a decision that felt like, and today it seems like it should have been an easy one, because clearly we didn't want to have people from 80 countries, 100,000 visitors to Columbus. Had we gone forward with that, the consequences would have been devastating. And so, but I know we all knew at the time that these decisions were going to affect small businesses and business in general in our economy. The coronavirus is not just a health virus, it is an economic virus on us all. And the fight to help get us through it on all those fronts is constantly on our minds. We have taken many steps, including the forgiveness of BWC payments through June, the insurance grace periods on a variety of insurance products, the regulatory relief that will help compliance and sustainability for many businesses, the actions that we took on evictions and mortgage relief, all of those are helpful. But I got a call really as the sun was coming up this morning from a couple of different banks who said, hey, we finally got the guidance from the Small Business Administration for the loans that are called the Payment Protection Program. This was passed in the CARE Act by Congress and signed by the President recently. The banks who will be administering these loans have the guidance on how you can apply. And many of them are doing that today. Some do not have the capacity to do it today. We'll be doing it next week. But in talking with the businesses on this virtual town hall, many of them talked about how easy it was. I had one business owner say that he had applied for the disaster relief loan program and the PPP loan program, and that it took him 10 minutes with each application. So no guarantees that what the experience will be for you, but it's as they described it, it's gone very well so far. It's important that you contact your banker or lender that you have a relationship with, credit union, whoever that might be, to initiate that process. It's focused on employers with 500 employees or fewer, and you can get a loan that may be forgivable. This is the key piece of this. You may say, I can't handle more debt during this time, but the loan can be forgivable for things like payroll, interest on mortgage, rent, and utilities. So a big boost there, I know, for many businesses that are struggling. So we encourage you to take care, to look into this to see if it works for you. No collateral, no personal guarantees, no fees involved. So they've tried to make this a product that can work for you. It's not just an empty promise. It really has some force behind it in terms of being relevant. I will say that you can call your bank, but you can also go to coronavirus.ohio.gov/business-help to find more information on this and a variety of other services that we are providing for business. So this is some good news that some of this stuff that happened in the CARE Act is starting to get enacted, and relief can get into the marketplace as soon as, hopefully as soon as you get that filled out and it gets processed. Yesterday, we announced the job search website. Many employers, while we have a lot of people who are out of work, we also have many employers in these critical areas in healthcare, the food supply system, pharmacy, even in manufacturing. They're making a lot of these important products that the governor has been pushing to get developed. Yesterday, we said you could post your jobs at coronavirus.ohio.gov/job search, or you could search there. We had 11,000 as of yesterday. Today, there are 21,000 jobs on there, just that turnaround in a 24-hour period. And I want to focus, if I could, just for a moment on one of those special places of need that I know that everybody will care about. We have the Ohio Veterans Homes in Sandusky and Georgetown. They provide care for 700 veterans, and they are in desperate need of nursing assistants and LPNs to serve the veterans that are in those locations. There are a lot of important things, but this is one that I know is important to all of us. And so if you can help, please go on that website and apply for one of those jobs. And another thing that was brought to my attention is that a lot of times, particularly now, these veterans or anybody can get lonely. And these folks would love to get a letter from you. And this may be an opportunity to bring our education system and our humanity together by having your child write a letter to the veterans in these homes. You might give them a little bit of a project to learn about all the wars and all these points in history and all the things that these men and women did to serve their country. So it's an opportunity for you to serve the people who served us, and we really encourage you to do that. Let me remind you that Election Day is set for April the 28th. Please, if you want to vote, go to voteohio.gov and get your absentee ballot application, or you can call your local Board of Elections. Don't wait. Because they have to send you an application, you have to send that back, and then they have to send your ballot, and you've got to get that turned in. So we want to get that turned around as quickly as possible. And finally, a little piece of good news to end on. I know that I heard the governor on one of our early calls this morning talk about how every night before he goes to bed and every time he wakes up in the morning, the thing that is on his heart the most is making sure that we have the PPE and all the equipment that we need for our healthcare warriors and first responders and everybody who's part of that system. And you know how we work to fight to give Battelle the opportunity to decontaminate the masks for hospitals and nursing homes and first responders. And thanks to the help of Jobs Ohio and a partnership with Battelle, they are going to make the sterilization process for all of those, hospitals, nursing homes, first responders, free for all of their masks for the next 2 weeks. We want you to get those in there. We need to get the supply chain going on this. It's going to really help populate our critical care situation with decontaminated masks. Even if you can get them right now, they're between $4 and $6, and that's a very big if you can get them. And so this is going to really help. Particularly, we know that a lot of the providers are struggling right now with the finances involved with this. This is just one more way that people are just all in it together. They're coming together to try to solve the problem, and we encourage the hospitals to go to the Battelle website and make sure you let them know what you want, when you're coming, and we'll help return more PPE to the people who need it most.
Also this morning on Columbus Concerns, we're going to hear from Jerome Adams, the Surgeon General of the United States, on the latest recommendations from the Centers for Disease Control and Prevention on covering your face when going out in public.
I want to unpack the evolution of our guidance on masks because it has been confusing to the American people. First of all, I want people to understand that the CDC, the World Health Organization, my office, and most public health and health organizations and professionals originally recommended against the general public wearing masks because based on the best evidence available at the time, it was not deemed that would have a significant impact on whether or not a healthy person wearing a mask would contract COVID-19. We have always recommended that symptomatic people wear a mask because if you're coughing, if you have a fever, if you're symptomatic, you could transmit disease to other people. What has changed in our recommendation? Well, it's important to know that we now know from recent studies that a significant portion of individuals with coronavirus lack symptoms. They're what we call asymptomatic. And that even those who eventually become pre-symptomatic, meaning that they will develop symptoms in the future, can transmit the virus to others before they show symptoms. This means that the virus can spread between people interacting in close proximity. For example, coughing, speaking, or sneezing, even if those people were not exhibiting symptoms. In light of this new evidence, CDC recommends and the task force recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. These include places like grocery stores and pharmacies. We especially recommend this in areas of significant community-based transmission. It is critical, and the President mentioned this, the Vice President mentioned this. It's critical to emphasize that maintaining 6 feet of social distancing remains key to slowing the spread of the virus. But CDC is additionally advising the use of simple cloth coverings to slow the spread of the virus and to help people who may have the virus and do not know it from transmitting it to others. The cloth face coverings recommended are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders as recommended by the current CDC guidance. As the President also mentioned, cloth face coverings fashioned from household items or made at home from common materials at low cost can be used as an additional voluntary public health measure. This recommendation complements and does not replace the President's coronavirus guidelines for America, 30 days to slow the spread, which remains the cornerstone of our national effort to slow the spread of the virus. CDC is always looking at the data. We've told you that from the beginning. Dr. Birx says it every single press conference. We're looking at the data, we're evolving our recommendations, and new recommendations will come as the evidence dictates.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.